Hello friends, this is I'm Meg Wahi and welcome back to Making Sense of the World, and this is the second episode and the follow-up. It's not really the follow-up of the first episode, it's a brand new topic. I'm sorry for the delay in and the space between the videos, but let's start without any further delay. So in this video I'm going to talk a bit about the coronavirus issue. I know you've heard a lot about it and you might be bored listening about coronavirus deaths and all that, so I'm going to put it in simple terms. I'm going to make only one video. Before we start, I want to make sure to tell you that this is all the stats are at the time of writing, so please don't write comments that this is the total number of deaths. So on the 31st of March at 8:30 p.m. This was the stats. Okay, so let's start. First, let's talk about the symptoms that we get to see in coronavirus. So the top 1%, the top symptom that we get to see is fever. You can get 100 to 104 fever in coronavirus, and along with that is dry cough. So these two symptoms are basically not one of a kind. But if you compare this with common cold, main symptom is runny nose, and in coronavirus, in only 5% cases we see a runny nose. So if you have a runny nose, you don't have nothing to worry about. It's a very small chance, like almost infinity small chance that you have coronavirus, and not common cold. When we compare it with flu, then shortness of breath becomes a unique symptom, because in flu and common cold, shortness of breath is not a symptom, and so it is unique in coronavirus. So 80% of the cases of coronavirus till now have been with mild symptoms, 14% have been severe cases, and 4.7% have been critical that need hospitalization, and the rest have been deaths. So if we talk about contagiousness, I will come to a topic called R0. R0 is the number of people that get infected by one person in a particular disease. So many diseases have different R0 values. Flu has a R0 value of 1.3. SARS has a R0 value of 3 to 4. But coronavirus has an R0 value of 2 to 3. So one person on average infects 2 to 3 other people. But we've also got to consider the country factor, since this is a worldwide statistic. And in India it's a lot, because of its population density, India's R0 value for coronavirus is 815. One person can infect 815 persons in normal community transmission. So India is trying very hard to prevent that. So when we come to mortality rate, so there have been 8,02,748 total deaths, 802,000 total cases, confirmed cases, 39,000 deaths, and 172,000 people have already recovered from this disease. So when we divide the total cases by the total deaths, we get the number 5%. So 5% of the people who got coronavirus died. But experts believe that the actual mortality rate is still 2%, because there are many cases that have not been discovered, because testing is very limited. The governments around the world are prevent testing. Many people are being being refused testing, and governments are saying that you should only come for a test if you are exhibiting symptoms. But as we saw, 80% of cases are mild symptoms, so people won't test with that. There are other factors as well for this mortality rate. For example, there's age. So 0 to 9 years of age, there is a 0% mortality rate. 10 to 39 years is a 0.2% mortality rate. Then we've got 40 to 49, which is a 0.4% chance. 50 to 59, which is a 1.3% chance. 60 to 69, which is a 3.6% chance, 70 to 79, 8% chance, and 80 plus is a 14.8% chance. So if you're young, you've got no need to worry, but still you've got to be cautioned, because if you catch coronavirus, then you might infect other people, and older people might be at risk getting the infection from you. Mortality rate also varies from conditions, medical conditions. So for example, a person with no underlying conditions has a will have a mortality rate of 0.9%. People with cancer have a mortality rate of 5.6%, high blood pressure 6%, respiratory disease 6.3%, diabetes 7.3%, cardiovascular diseases 10.5%. So we can see that people who have these diseases are more at risk. Interestingly, country by country mortality rates also vary. So in Germany, there have been 16,000 total cases, and there have only been 44 deaths, which gives us a mortality rate of only 0.27%. The UK, like in comparison, has a mortality rate of 4.4%. Italy 8.3%. So we can see how mortality rate varies country by country as well. So I would like to mention two countries that are doing very well in this issue. One is Germany and one is South Korea. So first, let's talk about Germany. I also mentioned that the mortality rate is very low. So Germany has been handling its COVID-19 situation well. It has a very low mortality rate. There are mainly three reasons for this. The first reason is that 70% of Germans who have coronavirus are young people, and because young people have a greater chance of survival, there have been less deaths. Second reason is Germany took testing very seriously and have been conducting tests on a very large scale. Germany's healthcare systems is one of the best, and the availability of hospital beds in Germany per 100,000 people is 823. That's why it's been handling it so well. And if we see Italy's number, it is 331 beds. So we can see why Germany is doing a lot better than Italy. South Korea is another example, as I said, which has been very successful in the spread, stopping the spread of COVID-19. The same reasons have been told for its success. There are sufficient number of hospital beds in the country. Testing of people was conducted on a large scale. The infected people were kept isolated. So this virus, so let's now talk about how this virus spreads. This virus mainly spreads from person to person contact. Another source is respiratory droplets. So for example, if someone sneezes or coughs and has the disease, and some particle of their exhibited particle enters your nose or mouth, then you also can get the infection. So if we want to prevent the spread of the virus, social distancing is the key. That is, we should stay at home. If we are going out, we should maintain distance from other people. And this is social distancing. You can find many articles how to do that, so I'm not gonna give details on that. Now let's talk about the Indian aspect. As I said in the first episode, that I'm also going to give the Indian aspect for all of these. So currently in India, there are 1442 confirmed cases, 47 deaths, and 140 recovered. You might think that if countries like the US and Italy couldn't control the virus, and they have some of the best healthcare systems in the world, to be honest, how will India handle it? So one reason that experts say that India will be able to handle it better is preparation. The US and Italy could not handle the load because they did lax preparation for it, while India, while in India, as soon as the government saw the situation getting serious, it banned all international and domestic travel and closed down schools, and has recently also imposed a 21-day lockdown on all people for getting out of their houses for any reason except for the essential services. And of course, if you are showing symptoms, you have to go to the hospital. And by comparison, the US hasn't even closed down its schools yet. So there are many reasons for this lockdown, but I have mentioned only a few. The first purpose of this lockdown is to stop community transmission. This reason has partially failed because the numbers that we're seeing in the news each day leave us with no doubt that the community transmission has started. And these numbers are not that accurate because government isn't providing enough sufficient kits for testing. So the real number might be much higher. The second is to prevent the peak of cases because of the R naught value that I mentioned earlier, so that there are less cases when the lockdown ends and the healthcare system can cope with the number of cases. The third reason is that so that it's enough time for the Indian healthcare system to prepare for the intense load that of coronavirus patients about to come into the hospitals. The fourth reason is that so that the heat of the Indian summers prevails and kills this virus. The killing temperature of this virus, death temperature of this virus is 56 degrees. But due to the hot weather in India, 45 degrees seen in summers, and the intense sunlight, there will be no problem of this virus when the summers come. But that's not to say that the crisis will end there. A pandemic is not one single wave. It comes in many different waves. Because even though India has a very hot summer, other countries don't, so the virus will stay in them. And when winters come, it'll come back to India and it'll stay in winters. And until 3-4 years, this will go on until almost all the people develop an immunity to it. So the next few weeks will be very crucial for both the Indian people and the Indian economy, because the Indian economy is going down very bad because of all the closure of restaurants and public places. So keep washing your hands and watching this space for more updates. Like this video, subscribe to this channel, and turn on that notification bell if you haven't already, and so that you don't miss any videos. Stay safe and bye bye. I'll see you.